Hello, I'm Garvin Lynch and welcome to Lynch's Pharmacy Health Video Series. This video is on ear complaints. The disorder of the ears are often associated with upper respiratory tract infections, so therefore are pretty common in winter, and they're very common in children as well. If they're very persistent, they need referral to a doctor, but if it's just a once-off case, then they can easily be treated with over-the-counter products. Problems in the ear are classified in terms of where they occur. There are three main parts of the ear: the outer ear, which is in the visible part and is called the pinna. Then there's the middle ear and then the inner ear. Problems with the outer ear would be otitis externa, which might be an infection or dermatitis of the pinna. It may cause dry, rough skin, or it might affect the ear canal. Excessive wax is also deemed a problem of the outer ear. Again, most of these can be treated with over-the-counter products. Problems of the middle ear would be otitis media, which is an infection, trauma, or perhaps perforation of the eardrum. You might have problems with the inner ear, such as vertigo, which is the sensation of the room spinning around you, and severe dizziness. It's caused by disorders of the structures inside the inner ear, often caused by a disease called Meniere's disease. It's the most common cause of vertigo, so the patient's symptoms and any accompanying symptoms are used to judge whether it can be treated with over-the-counter medicines or whether you need to go and see a doctor to have it treated. So some reasons to go and see a GP would be severe pain in the middle ear, maybe an unusual lesion in the pinna that isn't really causing an itch, or maybe just causing a mild itch. Any symptoms lasting more than a week, any prolonged hearing loss, deafness, any bleeding from the pinna that can't be stopped, any fever, neck stiffness, nausea, dizziness, vomiting lasting more than a few days would all be reasons for referral. In terms of management, if we start at the outer ear, dermatitis of the pinna is quite common, which leads to very dry skin. Often simple emollients like emulsifying ointment or aqueous cream are enough to treat it. Just apply them liberally. Apply plenty at a time and always after washing. If the ear canal itself is affected, it might be more effective to use olive oil. The olive oil that you can find in any pharmacy is good enough for treating any dry skin in the ear canal. You can often get what's called contact dermatitis, which is a very scaly, crusty skin. You might see it where there is crusting on the skin of the ear around an earring when there's a nickel allergy. So you would just be confined to the earlobes. If this is the case, you need to use a steroid cream. Hydrocortisone 1% can be used as long as there's no infection present, and generally not used for more than a week, as it shouldn't need to be used for more than a week. So the use of a steroid cream if there is contact dermatitis. If it's just dry skin, the emollients or olive oil should do the trick. In terms of wax, there are a number of products available to dissolve or loosen wax. Ceramol is probably the most common and most popular. When using any of the drops, the best way to use them is to lie down on your side and have somebody put in the drop for you. Stay in that position for a couple of minutes until they seep through. Most of them take a couple of days to work, if they work at all. If they don't work for everybody, but the Ceramol is a pretty well trusted product. Earax and Waxol are both pretty similar products which soften the wax. The wax generally runs out itself of its own accord after a few days. Exterol is similar to the other products, but it is used more for wax that is hardened. So tough, stubborn wax that just won't come out, then Exterol often softens it up and gets it out for you. There's a procedure that the doctor can do is called syringing. It's basically just injecting water at a certain pressure into the ear to loosen up the wax. But very often this isn't done until the wax is softened with some of these drops. So the Exterol is a good one to use before going to the doctor for syringing. The Odiclean is one of the newest products. It's natural and dry from seawater and comes with a little nozzle that you put in the ear and spray it in. It's very good for softening or loosening up the wax. Drops with painkillers in them tend not to provide much more pain relief than just oral analgesics like Nurofen, but they could be used in conjunction with them, or they might work on their own for some people. An example would be Tropex or Odex would be another one. So probably used more in problems with the middle ear like Otitis Media. As I've said, Otitis Media is down to infection. If it is an infection, it will need an antibiotic. But in the meantime, it can be painful, so oral analgesics would certainly be suitable along with a pain-killing drop like Tropex or Odex. So those are the most products available to treat any ear disorder. So when the patient has an issue, it's best to figure out, is it the outer ear, middle ear or inner ear? What symptoms that I've just mentioned refer to you in your case. If you have any questions, you can contact me through the Life Pharmacist on the website. You can email me or call into the pharmacy here in Broaddale and Douglas. Thank you for watching.